100 men. Half took the drug the dermatologist prescribes for hair loss. The other half used something that costs $2. 6 months later, same result. Nobody talks about that. Most men losing their hair blame genetics and move on. Some of them are right. Most aren't. Because the thing silently destroy your hair isn't in your DNA. It's in your routine, running in the background every single day. And here's the brutal part. Hair loss doesn't announce itself. It's so gradual you missed entirely. Until a photo catches you off guard, until a reflection you weren't expecting. By then, a lot of it's already gone for good. Dead follicles don't come back. They just stop. We're covering 4 things today. 4 things that decide what your hair looks like in 10 years. Most men are getting at least 3 of them wrong. But the last one, that's the one that explains the guy who does everything right. Eats well, trains, sleeps, still loses his hair. Goes to the doctor, gets his blood work done, told he's fine. He wasn't fine. There was one number nobody checked. And we'll get there. First thing, and it's going to feel counterintuitive, stop washing your hair every day. Your scalp has a protective barrier. It keeps bacteria out, moisturizing your follicles healthy. Shampoo strips it completely every time you use it. Takes 12 to 24 hours to rebuild. Wash daily and it never fully recovers. Your scalp spends its whole life unprotected, follicles in a permanently compromised environment. The fix is embarrassingly simple. 2 to 3 washes a week. Dry shampoo for the days in between. First week feels off. Then your scalp recalibrates. Stops overproducing oil to replace what you keep stripping away. One change, free, starts tonight. That's the free one. The next one also costs nothing, and the data behind it will surprise you. A group of men added exactly one thing to their routine. Same diet, same products, same everything, one variable. 4 minutes of scalp massage every day for 6 months. Hair shaft thickness increased, confirmed in a lab. Not a survey, not self-reported, a lab. Here's why. Your hair follicles respond to mechanical stimulation. Pressure on the scalp activates the cells that control your growth cycle. The protocol is nothing. Fingertips, small circles, full scalp coverage. 4 minutes. Do it in the shower while conditioner sits. You're standing there doing nothing anyway. Free, daily, backed by data, and there's no reason not to do it. Now, the $2 from the opening, here's exactly what it was. Rosemary essential oil. 100 men with pattern hair loss, 6 months, 2 groups. One group, Minoxidil, FDA approved, the pharmaceutical gold standard. The other group, Rosemary Oil, twice daily. Month 6, no statistically significant difference in hair count. Same result, Rosemary group had less irritation. A bottle of rosemary oil, $2 to $3. Minoxidil, $40 a month, every month, indefinitely. The mechanism is direct. Rosemary increases blood circulation to the follicle. Your follicles run on blood supply. Cut it off and they miniaturize, they weaken, eventually stop producing hair altogether. Rosemary helps keep that supply open. One caveat. One study, 100 men, Minoxidil has decades of data, but for $2 and no side effects, the math isn't complicated. How to use it? 2 to 3 drops in a carrier oil, like jojoba or coconut. Massage into the scalp 3 times a week. Never undiluted, straight essential oil on the skin causes irritation and completely defeats the point. Last one. This is the one that no shampoo, no oil, no massage will fix. Because it's not happening on your scalp, it's happening inside your body. You get a blood test, iron comes back normal. Doctor says you're fine. Hair keeps thinning. Here's what happened. Standard panels test circulating iron, what's in your blood right now. They don't test ferritin, stored iron, the reserve your body draws from to keep hair follicles in the active growth phase. When ferritin drops, follicles exit the growth cycle early, start shedding. Hemoglobin looks perfect, standard test looks clean. You have no idea, you keep blaming genetics. If your hair is thinning and you can't explain why, ask your doctor for a serum ferritin test. Not iron, ferritin, specifically by name. One blood test completely fixable if that's the answer. And for a lot of men, quietly losing their hair for no obvious reason, it is the answer. 4 things. Wash 2 to 3 times a week. Stop dismantling the only protection your scalp has. 4 minutes of scalp massage daily. In the shower. Free, the data is there, no excuse. Rosemary oil in carrier oil 3 times a week. $2, performed similarly to Minoxidil in 1 clinical trial. And get your ferritin tested. 1 blood test, ask for it by name. Potentially the entire explanation. None of this is being sold to you anywhere. No brand profits from telling you to wash less. No supplement company runs ads for ferritin awareness. That's why you're hearing it here and not somewhere else. Most men in this space will keep buying products that rinse down the drain in 60 seconds and wonder why nothing changes. You now know what actually moves the needle. Do something with it. And if you want more no BS breakdowns like this, subscribe.